In Health Matters with Dr. Angie today, you're welcome. Welcome, everyone. Thank you for always tuning in, trying to check on the videos to learn. And I believe you're also putting into practice the much you're learning from here and all that. So let me go straight to the point today. I'll be talking about some of the causes of epilepsy. What are some of the likely things that can make an individual to have epilepsy? In my previous video, I gave us an overview, what is epilepsy all about, and what are some of the symptoms that someone that has epilepsy can have. You can check that video so that you can follow up. Now, on today's video, I'll be talking about the causes of epilepsy. Number one, epilepsy can be due to brain damage around the time of birth. It can be because enough oxygen didn't get to the brain at the time of delivery. It can be because of a birth trauma, that is, this child sustained a trauma to the brain during the time of delivery. The child can come down with seizures later in life. That is number one. It can be due to congenital abnormalities. Congenital abnormalities are just some of the problems that a baby encounters inside the womb that ended up affecting the CNS. Okay, let me just put it that way so that I don't confuse you. So congenital abnormalities are problems, birth problems that start when the child is still inside the womb. Some of them, you can't just say exactly what caused them. So if there are congenital abnormalities that affect the brain, of course, the child can come down with epilepsy after the child is born. Some of them can be due to severe head injury. Possibly the individual or the patient had an accident where the person hit the head on the road, or where a very hard object hit the head and traumatized the skull and even the brain. So any type of head injury, severe head injury, remember, not just any kind of head injury, severe head injury, it can make the person to come down with epilepsy. Now, there are some kind of strokes that make the brain to be starved of oxygen. You know, like I explained to us in the cardiovascular system, oxygen is carried to every part of the body, including and especially the brain. Some kind of strokes come, and when they come, they starve the brain of oxygen because of where they are located. Such strokes can make the patient to have seizures, okay, even as an adult. There are some infections of the brain, like meningitis, like encephalitis, can make a patient come down with seizures. Now, some brain tumors. Of course, let me mention at this point that when somebody who has been normal, who has been fine, who has never had any seizures in life, as an adult has seizure for the first time, that person needs to see a doctor immediately because it can be the first sign of brain tumor. So some brain tumors actually cause fits, seizures in the body that the person will end up, when it becomes recurrent, of course, it will be handled as a case of epilepsy. Seizure can be controlled. What is the treatment? It can be controlled. You need to see a neurologist. A neurologist is a doctor who handles problems of the central nervous system. The neurologist, there are medications that these people can be placed on that will help them not to be having recurrent seizures. So it can be controlled. Their seizures can be controlled. Don't just leave them in the house to be fitting and be injuring themselves all the time. Epilepsy primarily does not kill, but sometimes what kills these people is the injuries sustained during the time of the seizure attack. Because like I said in my previous video, some of them will have injuries and fall into fire because sometimes they are not conscious. They fall into fire, hot oil, into pools and get drowned, and those are now the secondary causes of death, or rather the main causes of death for these people. So if you have someone with epilepsy today, take the person to the hospital, let the person be reviewed by a neurologist, and the neurologist will manage this person and ensure that the seizures are controlled. I will tell us what to do to help a person with epilepsy in my next video. So stay tuned, keep on checking this page for health tips. Remember to share, remember to like, remember to follow. Thank you. Have a good day. Bye.